Welcome everyone to the VLOGAN, a vlog for individuals with special needs and those who love them. Today, I am lucky enough to be joined by Christine Koterba, PhD. She is the attending inpatient pediatric neuropsychologist at Nationwide Children's Hospital and also an assistant professor at Ohio State. That's a mouthful. So thank you for being here, Christine.
Absolutely. Thank you for having me.
So if you could save the viewers from Googling some of the things that I just said, because I just Googled them before our interview. What is a neuropsychologist? And then a pediatric neuropsychologist? And then what does it mean to be an attending neuropsychologist?
I think about neuropsychology is kind of just what it sounds like. So you've got the neuro, so the brain part, and then the psychology, which I think of as, just kind of the day-to-day functioning and everything that goes into how a child or a person kind of functions day to day. So what I do is I work with kids who have had something happen to their brains. So this could be something developmental, so something that they're born with, or this could be something that's more acquired, so something that happens at a later point in their life. And what I do is I get to work with them and learn about them and learn about their injury or their illness or their condition, and then see through a variety of different types of tests and measures how that medical thing is impacting their day-to-day functioning. And so a lot of what I do is use different types of tests, like you've probably heard of IQ tests, or even tests of things like memory and attention and processing speed and problem solving. And then I'm able to compare a child's performance on those tests to a kind of how they should be doing if they were typically developing. And that lets me know what types of supports they might need in school or at home or out in the community. And I work with a variety of kids. Some kids I work with in our outpatient neuropsychology department. But as you mentioned, I'm the attending neuropsychologist on our inpatient units as well. And that's really my passion. That's the population that I really love. And those are kids who typically were just kind of generally healthy and typically developing kids. And then something happens, like they get in a car accident and they get a traumatic brain injury, or they fall into a pool and have a near drowning accident and lose oxygen to their brain. And so they get a brain injury because of that, or they have something like a stroke, or they develop new seizures. And so what I'm doing with those kids is I'm really trying to figure out where they are at that point in their recovery, and then how we can get them back into home, back into school, back in the community, and how we can try to get them to function as close to where they either were before, or how we can increase their independence as they're getting back into those settings where they were previously thriving before their injury or their illness.
Oh, thank you for explaining all of that. So
Yeah.
I got a few follow-ups. So you have both an outpatient role and
Yep.
an inpatient role. Outpatient role, I think you explained the inpatient. There's an injury or something occurs, and that child needs to be in the hospital and monitored, and then hopefully they go out of the hospital, and then do they continue with Nationwide and you as an outpatient?
So a lot of times what happens is once they're medically stable, they might end up going to our inpatient rehab unit where they're getting intensive therapies. And then again, we're able to set everything up for them to be able to discharge when they're ready. And then we follow up with them. So from a neuropsychology perspective, usually I'm seeing kids a few months after they've gone home. They might come back and see me for a follow-up evaluation, or they might be coming back a year, maybe a few years down the road. It really just kind of depends on what's going on and what age that they're at. And one of the things that I think is really interesting in working with kids is that we've got a lot of different developmental time points. So I might see a kid who was injured when they were maybe in preschool, and the needs might not be that great at that time. But then once they get older and they're getting to third and fourth grade or middle school or high school, those different transition points where we know things get harder for them in school, things might get harder for them at home, that can be times that they come back to see me so we can do an assessment and then update those recommendations and really tailor them to where that child is at different developmental levels. So we are seeing those kids come back for outpatient evaluations as well.
As the attending physician, does that mean that you have interns or fellows that are
Yep.
working that you're supervising?
Yep, exactly. So we have here at Nationwide Children's Hospital, we have one neuropsychology intern, and then we have 2 to 3 neuropsychology fellows. So what I do is I usually have 2 trainees with me all the time. And I'm really working to train kind of that next generation of neuropsychologists to either stay here or go out, at any various institution across the country so that they can do the inpatient and outpatient work like I do here at Nationwide Children. So some of the work that we do it side by side. We'll go together to meet patients and families. Other times, once they are kind of up and running and able to see patients and families independently, they might be going and seeing them on their own. But the way that training works is that any trainee that we have is always really closely supervised by a licensed psychologist who is able to, be involved in the patient care, give some guidance on how to handle different situations, sign off on notes, and that sort of thing. So I think it's really cool when patients and families get the chance to work with a trainee, because it's kind of like you get a 2-for-1. You have the trainee, but then you also have their supervisor as well. So you've got that kind of, 2 people working with your child and with you as a family.
Is that you? You're the supervisor?
Yep, I'm the supervisor for all of our inpatient cases. And then we have a lot of other neuropsychologists and psychologists here on our team who supervise other trainees as well.
So you mentioned that your tests and your evaluations help to determine what supports are needed. So
Yep.
where does that go? I guess the parents hear that information, but then what other team members are you working with, or who's part of the team that you're working with that takes your evaluation and then says, okay, here's the evaluation. Now let's put some rubber on these tires and where the rubber meets the road.
One of the things that makes working with kids really unique is that you have a lot of different stakeholders. So when I meet with a patient and I do my evaluation, I write up a report that has all of their kind of medical history, family history, school history, everything. And then it has the test results and kind of how I interpret those results. And then it has a lot of recommendations. And with kids, we're making recommendations that are really primarily for the school, and then some recommendations for home. Sometimes recommendations, we might say, you have ADHD, so why don't you go and talk with your pediatrician about medication for that? Or I might be saying, all right, we're planning for a transition to adulthood. It would be really good to involve an attorney like yourself to really help with that transition to adulthood and all the planning that needs to take place. So it really kind of depends on what the needs are of that child and their family, but really the report is written for a variety of people. And then I'm also working directly with my medical colleagues here. So if I know the pediatrician, I might reach out to them directly and say, hey, I diagnosed ADHD in this child, and at your next appointment, could you talk to them about medication? Or if, I don't work as much with our epilepsy surgery population, but some of my colleagues do. And so our evaluations, when we're looking at something like that, is really going to inform kind of how the child is functioning in the context of their epilepsy, and thinking about, all right, how are these test results going to impact their surgical outcomes? So we're having conversations with a lot of different people that are involved in the child's care.
Yeah, I got it. Thank you. You answered my question just awesome. And in such a way, you're great at just explaining things in a way that a person like me can understand.
Thank you.
How does somebody get in to see you that hasn't had an injury like a near drowning or a car wreck or a bicycle wreck? How does somebody get in to see you? Or how do they, and even more than that, how do they know that they should be coming in to see you?
Yeah, so that is a really, really great question. So first of all, there are a lot of different types of neuropsychologists and psychologists that do cognitive testing and that can help with school supports. So kind of the first thing is, if somebody has had some kind of medical condition that could impact their cognitive functioning, neuropsychology is a great fit. So this could be something like, we see kids who were exposed to drugs and alcohol when their mom was pregnant with them. So, that might not seem like something that's really a medical condition, but it affects how the brain develops and it affects how kids function later in life. So we see a lot of those types of kids for neuropsych assessments. The kids we don't see here at Nationwide Children's for neuropsychology are kids who only have something like attention and learning concerns, but nothing medically is going on with them. We do have psychologists here who do what's called psychoeducational evaluations. Those are pretty similar to what we do in neuropsychology, but those don't have kind of that medical piece because we don't really need to be considering the medical history if there isn't anything there. So those kids are going for psychology evaluations, but I do have colleagues out in the community who are in private practice and who practice neuropsychology, and they see a lot of kids where they have attention and learning concerns, but not as much of that kind of medical piece there. So that's an option as well. And then we do also have some kids who are really low functioning and really struggle with a lot of things, may have been in special ed their entire lives and may not be able to live independently. And it might be really hard to actually even be able to do testing with them. And we have psychologists in our Child Development Center here, or the CDC, and they will see those kids as well. They also specialize in kids who have autism and other types of developmental delays. So it really kind of depends on what the issue is. Our behavioral health intake coordinators are really, really great in figuring out kind of where to triage kids, depending on what their diagnosis is. So first of all, I would say that if you are a parent or a caregiver of a child and you're just feeling like something's just not quite right, like they're not meeting their developmental milestones, or school just seems to be so much harder than it should be for them, then an evaluation through Nationwide Children's could be really helpful. We do, of course, have wait lists for these types of things. And so we also encourage families to talk directly with their child's school if they have school concerns. We can help partner with the school team. So I oftentimes will see kids where they've had some testing done through school. I'll do a little bit of testing to add on to that. And then in some cases, we're able to kind of supplement what the school has done to help provide additional recommendations. So I would say if you have questions or concerns about where your child is functioning and you think that an evaluation like this might make sense, the first step is to contact our behavioral health kind of intake line. We can kind of take it from there and figure out the best place to put kids. And then we always start with an initial interview where we're able to figure out what's going on. And in some cases, we might say, hey, actually, you had this testing done through school. This looks really great. We don't need to do additional testing. So an initial appointment doesn't always lead to, a lot more services and evaluations.
Okay, so a lot of my viewers have children with autism. So those children would not see you, but they might still want to contact the behavioral health intake if they're turning over every stone for supports and evaluations and information.
Exactly. And like I mentioned, our Child Development Center, they specialize in working with kids who have autism. And they have a lot of really wonderful psychologists who are very highly skilled in assessing for autism. We also have the CASD, which is the Center for Autism Spectrum Disorders, and they do more of the kind of treatment and intervention and that type of thing. So again, our intake coordinators are just really, really wonderful, super knowledgeable about all of our behavioral health service line. And I have to be honest, we're growing so much that there are a lot of services out there that I'm not even aware of. And so again, our website is really helpful with providing all the different types of services that we have to offer. And then I just can't say enough about our intake coordinators because they are really, really great too. They also help a lot with families who need to find local resources. So they have, lists of local resources that they can provide to families who call in as well.
Awesome. Thank you so much for that. Now, when I was reading about you, I noticed your interests among many in your work is traumatic and acquired brain injury. Now, I think I know what traumatic is, but what does acquired mean?
Traumatic brain injury is kind of just what it sounds like. So there's something traumatic that happens, and it usually is related. The kids that I see are usually in high-speed motor vehicle collisions. So a car crash, car accident, or they might have had a really bad fall, or they might have been hit by a car. So traumatic really implies that high force that is being inflicted to the head or the brain. Gunshot wounds also fall into that category. And then we have non-traumatic injuries or acquired brain injuries. And this kind of includes everything else that could happen to the brain at some point during a child's life. So it could be saying, like I mentioned, like what's called an anoxic brain injury, where someone loses oxygen for even a short period of time to their brain. It can be something like a brain tumor, a stroke. It could be an illness that a child gets. So there's something called encephalitis, where kids can get kind of an infection in their brain, and that can cause usually a relatively mild brain injury, but it really includes kind of everything else other than something traumatic that happens.
But would it include a traumatic experience where, and is that even, where a child sees something and their brain is changed, or is that not something that happens and something I think I've read about but haven't?
I think when it comes to brain injuries and how the brain functions, there's still a lot that we don't know. I think that what I think a lot about with the kids who I work with, and I'm always considering in my evaluations, is how do the things that are happening around them in their environment or the things that are happening to them internally, how does that impact their day-to-day functioning and their ability to perform on the types of tests that I give? So like the thing, kind of what you're mentioning here, you could have a child who has experienced a lot of trauma in their life. And I don't think about that as so much as a brain injury where it structurally injures the brain, but I think about it as something where it changes how the brain functions and it changes how the child functions, changes how they see the world. And so, you could have somebody who does not get adequate stimulation and they're neglected early on in life. That can have huge implications for how the brain goes on to develop over the course of their life. You could have someone who, like you're mentioning, has kind of witnessed a very traumatic event and may have symptoms of post-traumatic stress disorder. All of those things can make it hard for you to perform to your true kind of cognitive ability level, kind of to reach your full potential, because they can make it hard for you to do well on the types of tests that we do or tests that you take in school or that type of thing. All that can affect your ability to pay attention, to concentrate, to learn new information, recall that information. So even though there hasn't been kind of a structural injury to the brain, those types of experiences can really impact how a child functions. Does that make sense?
Completely. Once again, you've explained it in a way that makes sense to somebody who has no background in this. So thank you. Well, I want to thank you for joining me today. We are so lucky to have you on this vlog, but also at Nationwide and in Ohio State. We're lucky to have you, and we hope to keep you around. I know that good people are hard to keep at hospitals. So thank you so much for joining me today, Christine.
Absolutely. It was a pleasure to be here.
Thanks. I hope you enjoyed this episode of VLOGAN. Please like, share, and subscribe to the RRPG channel so you can stay up to date with some of the latest news in the disability community.